Hi everyone, it's Jenny Wheeler, and this is my video to present my assignment 2. What I did for assignment 2 was a community-based assessment within my team at Klamath Basin Behavioral Health, and our correction site is where I work and am doing my field placement this year. This assessment is focused on personal self-care and how self-care correlates with effective practice with service users and burnout amongst clinicians. I was able to facilitate 4 focus groups for this assessment. Each group consisted of 6 SED team members, substance use members, drug and alcohol counselors, and 4 SED counselors and 2 mental health clinicians. The first time that we met, we did the Ardell Wellness Stress Test. The Ardell Stress Test was developed and by Dawn Ardell, and it is a kind of a unique holistic approach to stress. The Ardell Wellness Stress Test incorporates physical, mental, emotional, spiritual, and social aspects of health for a balanced, for a well-balanced individual in assessment. So individuals were asked to rate their satisfaction with each of the following 25 items that were on the stress wellness assessment. The 1, 2, and 3, 1 was mildly happy, 2 was very happy, and 3 was ecstatic. And then it went to -3 as completely dismayed, -2 very disappointed, and -1 mildly disappointed. And there was a list of 25 questions that each individual needed to assess with that, using that scale. Of those questions, some examples were like choice of career, marital status, capacity to have fun, body image, home life, if there was any learned stress management capacities or techniques. Nutrition was a couple questions about nutrition, confidence, where you are in your life, choice of whether to be a parent or not to be a parent. So there was a lot of different questions on this assessment that kind of asked about all aspects of each individual's life. And the majority of us that participated in this wellness test, stress test, was the test interpretation were anyone that was over 51 to 75, that they were actually a self-actualized person. None of us were there at all. Plus 25 to 50 individuals mastered the wellness approach to life and have the capacity to deal creatively and efficiently with events and circumstances. One of us was very close to that. One individual, a male counselor, his score was a 24, and what that meant for him was that he was a very wellness-oriented person with an ability to prosper as a whole person. And the list goes on and on. The majority of us were between the -25 and -50, the 0 to -24, which meant that we were a prime candidate for additional training in how to deal with stress. Or some of us had experienced a sudden increase in potentially negative events and or a circumstance or situation that potentially caused emotional setback for us. And so after we did that test with our first focus group, we were kind of able to identify where we were at with our stress levels. The second focus group, we did a self-care assessment. And with that assessment, it was a 40-question assessment that rated our 1 was very true, 2 was somewhat true, and 3 was rarely true. That was the scale of responses that we answered. And the majority of us on that scale that the majority of us responded more than 15 times to very true, and which meant that it was definitely a close time and take a careful look at our self-care issues. So a lot of us really could relate to that second self-care assessment, as we all felt that we needed to have better self-care management and really looking at how it affected the service users that we work with, and also kind of the effectiveness of our work. So that assessment tool for us was really pretty eye-opening, and it actually was very impactful to the majority of us. The third focus group, we did an emergency self-care worksheet, and this was kind of a worksheet that I put together kind of based off of something that we do in our groups, which is through our success planning. And it just was it's the emergency self-care worksheet is, we've made a list of who or what we could do when we were upset, and what things would help us relax, and different techniques that we could use. We really identified through this emergency self-care worksheet what things we like to do when we were in a good mood. So when we weren't in a good mood, we could go back and kind of remember and maybe do something like that, take a walk, and so on. And identifying different coping skills that are going to help us cope through our days. And a lot of some of those examples were avoid caffeine. If we were feeling anxious, remember to breathe, be very mindful of our thoughts, and how our self-talk is, and really just trying to remain mindful and staying in the moment. There was a few other questions on this wellness worksheet, or the emergency plan worksheet, but a lot of it was focused more so on positive things that we could do for ourselves during our day, and little techniques that were going to be able to take us away from our day more so. And we all really agreed that, if we had more time, if we took more time within our days to breathe and to relax, that among many other things, but really just taking time out more so during the day, it would help increase our effectiveness with our fellow service users, and also, just overall wellness at work, and overall our productivity, because that is a very big stressor for us at KBBH. Our notes, we are seeing individuals 6.5, 7 hours a day, and we have lots of clinical documentation that we need to stay up on, and that's a real stressor for a lot of us. So the last group was a planning group for change and implementation of those different techniques. And some of the things that we were able to come up with was really working together as a team to help us meal plan and kind of eat better. We discussed having healthy potlucks, a couple times a week, where we all could bring in an item, and then just kind of, have some really healthy fresh fruit, fresh vegetables. We are part of the Blue Zone, and our site, all of our KBBH sites are becoming Blue Zone friendly. So pretty soon, no one is going to be able to smoke on property. The snacks and stuff that have been served are fruits and vegetables and very healthy decisions, as opposed to like the ramen noodles and the cookies that we used to always have in our lobbies. So really looking at like the Blue Zone guidelines and recommendations, and really working towards implementing more so more at the clinician's level, as opposed to like an agency level. We also decided that we are going to do our very best at least twice a week to implement a Tai Chi break or a yoga break for 10 to 15 minutes. We also are working with the agency to develop a discount for gym memberships for not only ourselves but our families, and also really thinking about forming a self-care committee that is going to help meet the needs and really do some further deeper assessment into the self-care needs of the employees of KBBH, because it starts, if we aren't taking care of ourselves, we're not going to be very effective with the service users, and that's just the bottom line. Having more trainings around secondary trauma and compassion fatigue, we really identified that as a very strong priority. And, along with all of that, the effectiveness and the the effectiveness of our job and the effectiveness with the service users, it all is very much so affected if our self-care is not something that we're making a constant effort to better ourselves. So this was a really fun assignment. I enjoyed it, and I think my fellow coworkers really enjoyed it. We also one more thing we decided to, there's one of our coworkers, she survived cancer, and one of the big ways that she was able to beat cancer was through how she eats. And she actually has a group with the service users that is called Recovery Through Food. And she's developing a cookbook, and it's actually really amazing what she's doing with the individuals that we work with, individuals who are experiencing addiction, homelessness, traumatic childhoods, and severe mental health issues, bringing the idea of clean eating and foods that are going to help with triggers and cravings and emotional regulation and insomnia. So the group itself has been really amazing. It's been wonderful for our service users, but it's also been very beneficial to us as coworkers, because we are starting to use more of those recipes, and it's really becoming a lifestyle change for some of us. So, yeah, this assignment's been great, and it is very connected to my own learning needs, because I tend to absolutely 100% overwork myself, and I see that the need for self-care, and for me to keep my own personal self-care always very mindful of that, is very important for myself, because if I do not, I know that as a social worker, I'm going to be really tired, and I don't want to burn out. I really don't. I really want to stay aware of myself and take breaks and vacations and do what I got to do to take care of myself, so I can better serve those individuals that I work with. So thanks for listening to my video. Sorry I didn't have my PowerPoint presentation up as well along with this, because I'm having some technical issues, and I've been spending half the night trying to figure it out. Anyways, thank you so much. Have a good night. Bye-bye.